Meeting to order. The first thing on the agenda is the approval of the agenda.
Move approval.
Second.
Got a motion by Jim, second by Kevin to approve the agenda. Any discussion? All in favor?
Aye.
Opposed? Okay. Next thing, you got any citizens that called in? All right. Then we'll go right into our monthly employee recognitions. Do we have our... Are we ready for that? It's almost my favorite thing, get to meet some more employees. The first thing we got is Melissa Hartness. Melissa has 15 years. This is presenting grateful recognition of 15 years of outstanding and dedicated service to Clay and its citizens. Thank you very much for your service. Jamie, you got a few words for her?
Yeah, good morning. Just wanted to mention that Melissa joined Clay County Public Health as a member of our family home visiting team. And so she was actually a certified family home visitor. She was a child passenger safety practitioner, child care health consultant, and also the children's health services provider in terms of providing assessments. And so then in 2016, she joined our adult health team as a MinChoice's certified assessor, and so she brought all of that experience and knowledge to her adult health assessor role. Thank you, Melissa.
Thank you, Melissa. And Liz Burns with 20 years of service.
Thank you.
And Ron is going to say a few
I
words.
am. First of all, it's fun to be back here. 20 years Liz has been with social services. So Liz started out in our social service department as an office support specialist. And then from there, she went to our child support fraud and collections unit as a office support specialist, and then went to our income maintenance unit. So she has been everywhere in the agency. So it's no wonder why she is our go-to person. She trains a lot of new OSS. She is our go-to person for our electronic document management system and working with our vendors, so we really appreciate that. Amazing, upbeat, great personality. She's just fun to have in the office and her employee with us. Thank you, Liz.
Well, thank you for your service. As I said, I always like this part of the month, but now they come with masks on, I get to know it, don't know them anyway now. So I'm right back where I started from, I still don't know her. Back to the name tags, okay. Okay, next thing we've got the approval of the minutes of July 21st.
And just of note, in my committee reports, it should be Derek Lapointe instead of Darren.
Okay.
With that change, I'll make a motion to approve.
Second.
We got a motion by Cheney, second by Kevin with changing the name of the person involved in Cheney's committee meetings. All in favor?
Aye.
Opposed? Okay. Approval of the payment of the bills and vouchers.
Move approval.
Got a motion by Jim,
Second.
second by Kevin. Pay the bills and vouchers. All in favor?
Aye.
Okay. And with that, we'll go into our update with Jamie, and Kathy, and Cheryl. Have you already got some handouts that you should have in front of you?
Good morning, Mr. Chair and Commissioners. We have our weekly COVID case information, and I think you have that one-page sheet. So it's showing the totals again of Minnesota positive cases. So they are at 56,560. with 622 new reported cases, 1,616 deaths, so 2 additional deaths since the last amount that they had. And then Clay County, we are up to 745 positive cases, 2 newly reported cases, and we have 40 deaths. That was just 1 additional death from the 39 that we had previously. So Minnesota has now completed 1,070,000 completed tests on 8/2. They've had 15,870. So, you know, their goal was to hit 20,000. So they're doing pretty well with the testing. They test with the MDH Public Health Lab, which is very minimal. Most of their testing is done through other external labs that they use. Hospitalizations are up a bit in Minnesota. So there's been a little bit, about a 5% increase in the number of people that are hospitalized in non-ICU beds. And there's been an increase in the number of patients in ICU as well. So there's been a little bit of an increase in those. It's moderate, it's not an extreme high level, but just to note that that's what's happening.
Kathy, can I interrupt really quickly?
Sure.
Sorry. So the positive cases for Clay County is at 745, and it says there's 2 newly reported. Is this a daily sheet? Because our confirmed
Yes.
cases last week was 707.
Right, yes. So in daily, they change those and they fluctuate because first there's preliminary information that they give us and then they have confirmed information later.
And then in terms of Clay County's active cases, that's not included in this information today. Do you have that?
You know, I have the active cases from the 28th, which was 16. and
Yeah, I have that one.
Yeah, and I don't have the active cases for this week. I apologize. I can
Okay.
get that for you, though.
Okay, and then my other question is, I know that we're kind of in that second rise. The hospitalizations in intensive care right now is 153, but when it hit its peak a couple months ago, what was it, in the 190s?
190s, yeah.
Okay, all right.
And again, the hospitalizations are across the state of Minnesota. So that doesn't include, of course, Sanford and Essentia over on the Fargo side, which most of the Clay County residents would be hospitalized at.
I
So
know
this-
we've talked about that a million times probably, but is there any way we can get that so that residents can get a better snapshot of what's happening?
Right, and I'm working with emergency preparedness individuals at Sanford and Essentia to try to get that exact number of Minnesota people that are hospitalized or in ICU. So they're hoping to get me some of that data. I don't know if I'll get it weekly.
I think even though just to track what they're seeing within the Fargo-Moorhead region, even if it's not isolated to Minnesota residents, so that we can better see
Sure.
trends.
Yeah, waiting to hear back from them, but yeah, that would be good. The numbers are lower, of course, than the Minnesota hospitals, so they aren't at a capacity. So that's been positive, but I'll try to get those numbers. I've been working on getting those. It's a little bit of a challenge, but we'll try to work on that. Any questions other than the number of active cases, which fluctuates
I
all
would
the
just like
time?
to say that this format that you have been giving us, I really like this format. and
Okay.
I don't see it here today, so.
We can still give that to you. The numbers fluctuated so much, we weren't sure
Yeah,
if
well, that's
if you
why
were
I like to see
interested
it.
in the inaccurate numbers, but we'd be happy
Well,
to
I think-
send those to you.
I think what he's saying is we keep all of these, and so even though they're fluctuating, we're able to look back on it and it
Sure.
helps us get a better sense.
And see the rates. Sure, yeah. And of course, they're across the nation, you see the fluctuation of hotspots and what's been going on. The Commissioner of Health is still concerned about people following the advice and listening to the public health advice about masking, social distancing. So there's still some concern about some outbreaks in large group settings, so events that are happening. So she just, again, wants to remind the public, and we do too, that it's very important to continue the social distancing. Even though we're not in a hotspot area, we don't want to become one. So the social distancing, the masking, washing your hands, following all of those things, the guidelines that we have talked about, it's our only means to put a crimp on COVID spread. So we're really pushing that. There's some events coming up that might be of concern, but that's kind of the push, is to be diligent. As much as we maybe are tired of hearing about that and tired of masking and doing all those prevention methods, that's all we have right now. So, and then the second page I have is Minnesota has come out with a 14-day COVID case rate. And so I gave you a sheet that you can look at Clay County's. It's over a 14-day period per 10,000 people. So they have a formula that they're using, and this may help. This is one of the tools in the toolbox for schools to determine what they should be doing. So as you can see, in May to June, the rates were down, and we've slowly climbed up. So July 5th through the 18th, we're at 14.97, and then I determined the next 14-day period, we were at 15. So if we look at the policy options, so one of those, if you have 10 to 20 in that range, they're talking about elementary, in-person, and middle and high school, kind of a hybrid, so in-person and remote. So this is one of the tools we've been communicating with all the schools, and maybe Cheryl can talk a little bit more about that, but we'll be working with them on utilizing this to help them make some decisions.
Kathy,
Okay.
I had talked to you last week when the information came out from Governor Walz about how can we publicly display this information. Have you had any guidance as to?
Yeah, well, now that we've been able to share it with all the schools and have a little conversation with all the school superintendents, K-12, we'll now post it. So
Okay.
we'll post it on our website as
Okay.
well as on the Facebook page.
Okay, and then do you know I know the population estimates have kind of fluctuated. Do you know what population estimate they're working off of?
We use the 63,999.
Okay, thanks.
63,999 is the population rate, but it does fluctuate, and it depends on where you look to see what the population is. But that was part of the formula that we
Great,
used.
thank you.
Okay, I'll go to Cheryl to talk about immunizations.
So last week, when we were here, I mentioned the potential of having a vaccination clinic, and I was able to order vaccine, and that's being shipped, so we're in good shape for that. So next Monday, August 10th, and Tuesday, August 11th, I'm going to be offering an immunization clinic at our public health clinic in Suite 105 of the Family Service Center. We're going to run this from 8:30 in the morning until 4 o'clock in the afternoon. It's going to be for basically school-age children and older, so we're starting with age 4 and older, so that these children can get caught up with their immunizations. And I've actually gotten requests from some college students that need to get some immunizations as well. So we're going to go through adults. This is going to be by appointment only, since our building remains locked at this time. So they will call our clinic number, which is 218-299-7777, and then press 2 for the second option at the prompt. The majority of the vaccines that we do at our public health clinic are Minnesota Vaccine for Children, and there is some criteria that you need to be eligible for. So we are going to post that eligibility criteria on our Facebook page as well as our website. And if people have further questions and don't have access to those two modes of information, they can certainly call our clinic number that I just gave, and we'll be happy to answer any questions that they have.
How many people do you expect to take? I mean, how many could you take? I mean, if you do by appointment, what are you setting your appointments up at 5-minute intervals, 10-minute?
Usually it's a 15 interval for younger children, just because oftentimes with younger children, there's some apprehension. And just to give a little bit more information to people, we do a lot of education when we give immunizations. So It's not just giving them the vaccine information statement, which we're required to do by federal law, but we answer all sorts of questions when they come in for immunization. So I haven't figured it out as to how many we can take. I am going to have another public health nurse that is going to help me with some immunizations that day, so there'll be 2 of us. And we'll see. We've already have about 10 people that our support staff person in the clinic has been collecting names and numbers of when we could offer these immunizations. So we'll be contacting those people first to give them the opportunity to choose which day and what time they would like to come, and then whatever people call in. We'll also be screening them when they come to the door, because we want to make it clear this is not a walk-in clinic, because we do not want people congregating in the area. So if we have people that come too early, they may be asked to stay in their car until we have our opening, and then we will screen them at the door and encourage them to wear their mask when they come.
Well, if you get more than what you, if they don't have an appointment and they come, what are we just going to send them away, or what's?
It depends. If we already have that time allotment filled for another appointment, then we may have to ask them to reschedule, or they can wait if we have an opening a little bit within the few minutes. But if we are completely booked on our schedule, we may have to ask them to reschedule.
Okay. And just for that information for the public, that number was 299-7777.
Correct.
Okay, go ahead.
I also wanted to mention, as Kathy was talking about the case rate by county, the part of the toolkit for school districts to make their decisions on how to approach their learning methods this year. And we have given this information to all of our school districts in Clay County, and some of the districts have reached out and would like to have a meeting with us just to talk through the data, when we'll be sharing that with them, and also any other questions that they have, because they're also figuring out areas within their school to provide space for children that need to be quarantined, if they do have signs and symptoms of COVID-19, so that they can be placed away from the general area until their parents can come and pick them up. So we'll continue to work with them. I'm still having conversations with all of our higher ed facilities and answering any questions that they may have as well.
All right.
Thank you.
Morning. Just a few highlights from the Minnesota Department of Health press conference yesterday with Commissioner Jan Malcolm and then the infectious disease director, Chris Ersman. So a couple of things they talked about were plasma donations. And so we've talked a little bit about plasma donation and how that helps to treat, but also that it's being used for research. So they highlighted that and really encouraging people to get out there and donate plasma. And then they also were talking about COVID vaccine, and so Minnesota has been chosen as one of the 4 pilot sites in the nation to participate in that, and that is because of their long-term relationship with CDC and providing vaccines. So they were proud of that opportunity, and more information will come on that, but that'll be a future vaccine testing pilot.
Where are
And
the
then-
other states?
I don't know that. They
Okay.
didn't mention that in the conference, but we can sure find out. So then another thing is just about antibody testing. And so there's been a lot of discussion about antibody testing and opportunities, but just wanted to make note of the fact that we have opportunities in our community. One is Vitalant. If you donate blood, you can get tested. And then also Sanford Health is promoting antibody testing for anyone. So you don't have to be actually one of their patients. If you are a patient, you're going to get your test results back in 3 to 4 days. If you are not, you'll receive a letter in the mail. And those are, they're not billing insurance, but they're charging a $65 fee for that. And so, again, that kind of just tells us, at that time, we don't know what it means long-term. Same discussion is going on with testing vaccine. Will the vaccine be effective? Can we maintain our immunity with the antibody testing? And so that all is being studied. Going back to the vaccine discussion, they're looking at what will be the long-term coverage of the vaccine. Would we need a booster? Just as an example, when we start young children on flu vaccine, influenza vaccine, they have to have a booster because it takes a second dose to build their immunity. So those were kind of some of the highlights, just wanting to remind people that if you do get antibody testing, you need to continue to follow the guidance for social distancing and masking at this time, because we aren't real clear on whether or not you can spread the disease at that time. So that was pretty much the highlights of yesterday's press conference.
So if I had COVID-19 and I want to donate plasma, how long do I have to wait, or how serious does my COVID-19 have to be that my plasma will be good?
So part of what they're doing, if you're donating blood or you're going in for a surgical procedure, or if you're going to donate plasma, is they're screening you for that. So you would not be able to do that. So you'd have to, if they identified that you were positive, you would have that isolation period you'd have to follow, which is the 10 days plus.
Okay, but I heard of people donating blood afterwards, after they've had it, so.
And the plasma donation is what, if you donated plasma and you had COVID and you were over it, and so then at that case, it would possibly protect someone else. So it gives them kind of an immunity boost. And so that's what they're using the plasma for, to treat other people who are critically ill in the hospital, and then also for research purposes. That was
Okay,
the
but
other
how
thing I
sick do
mentioned.
you have to be to donate that plasma? That you've got
Well, I think if you test positive, then you've had the virus, and so that's it.
I
mean,
think
that's
that you
all
have to
we're-
recover, though.
Yes,
Yeah.
yes.
Yeah, you have to be
Again,
recovered, I
yeah.
realize that, but if you just had a symptom,
If you
one
test-
symptom and.
If
I
you're
mean-
positive, you're positive, so,
Okay, very good,
Yeah.
thank you.
yeah.
I think to add to that, so if some people are asymptomatic, and some people have just minor symptoms, so it isn't that if you have a minor symptom, you still, and maybe you even didn't get tested, but if you have this antibody test, it will show that you previously had COVID. And so then you'll know. We still don't know what the protection period is, like Jamie mentioned, so we don't know the period of time that you're really going to have some immunity. That's still in the studies.
Okay.
So,
Thank you.
yeah. A couple other things, there's some scams going around, and one of them is that contact tracers or case investigators are asking for credit card information. So if anyone's calling and asking you for some credit card information, that is not a case investigator or a contact tracer. We do not ask for any of that. So just for the general public, if you have someone calling you and asking you for that information, don't give that out, and that is not a case investigator. There's also another letter that's circulating about not wearing masks. It looks like it's an official letter. Some people are receiving that about not wearing masks. So that is not the case. That's not the recommendation. That's not coming from CDC or Minnesota Department of Health. So just a caution to the public. There's those kinds of things that happen, and they're out there, but those are two of the things that are happening that we are aware of right now, so just to be cautious of that. Any questions that we may or may not have answered, or any questions you may have?
Yeah, sure, when's this gonna end? Okay,
Oh, if it only could be tomorrow, right?
no.
Yes, we would love to say it's going to end soon, but
No. Thank you for what you're doing, and thank you for the update, and appreciate your work that you're doing.
sure, thank you.
Thanks also, Kathy, for your presence at our CARES Act
Yeah.
committee meetings. I know that that's been an added task on your list, and I think you're representing the best interests of public health well there, but also the citizens of the county as we look forward to what this may mean for the next six months or so, maybe longer, maybe shorter.
Thank you. Okay.
Okay, the next thing we're going to take is our proposed allocation of CARES Act return to work policy. This was part of our PIC committee that we had last week. Darren Brook will take care of that.
Thank you. Kathy's gonna fly as my wing woman today on some of this stuff. As you know, back on July 25th, Governor Walz put into effect the mandatory mask policy. And so, as part of our safe return to work policy, we knew that was going to be a flexible document as things progressed through this pandemic. And so we had to change the policy a little bit to comply with the new Governor Walz's policy on mandatory masks. And so we met with the PIC last week. This Governor Walz's order went into effect on July 25th. So we updated the policy. Kathy was certainly involved with that and did most of the work, I think. And we emailed that out on July 24th to the county. And so I think I included a copy of the new policy as well. The biggest thing is basically if you're indoors and you're not by yourself, you have to have a mask on. Now there are some exempt people, and those would be people that have a medical condition. The tricky part is you can't really ask them what that medical condition is, but if they do have a medical condition that interferes with their breathing or asthma or anything like that, then they would be exempt. Also, children that are under 2 years old should not wear a mask, and children 5 and younger, between 2 and 5, are encouraged to wear a mask. And there are times when you can temporarily remove your mask. That would be for organized sports, exercising, testifying, speaking, or performing, or presenting something, swimming, eating, and drinking. Try to maintain your 6 feet distance at all times. If the law enforcement asks you to identify your verify your identity, this is another time you can temporarily remove your mask. Or if you're communicating with a deaf or hard of hearing person. And then, of course, if you're receiving services from a doctor or a dentist or something like that, you can temporarily remove your mask. The bottom line, after this, reading through this 15-page order and our 5-page policy, the bottom line is whenever you're not alone in the county, wear your mask. That means going to the bathroom, walking down the hall, going to the break room. Anytime you're going to come in contact with another person, wear your mask and try to maintain the 6-foot distance as much as possible. There's still language in there about if you can work from home, you should still work from home. And the other thing that we had, not only in our PIC, but also in our managers meeting, is some discussion on face shields. Face shields, you can wear face shields if you're not able or capable of wearing a mask, and we highly recommend that as well. So that could be considered an accommodation. If somebody said, I can't wear a face mask, and they can't work from home, that possibility remains that they can wear a face shield as well. And we do have plenty of them, from what I understand. And then the only other thing that we really changed in the policy was our first policy, when it first was initially drafted, said no out-of-town travel. And that has been changed to most out-of-town travel. Maybe not out-of-town, out-of-area.
Out of county.
Out-of-county. So leaving that up to the supervisors to see if their employees should or should not travel during this time.
Is that on company time or on personal time?
That would be on company time.
Okay.
Yes. And that is about it, unless you have any other questions.
So we need a motion to adopt this policy, is I take it?
I guess to change the policy or update the policy.
Okay.
would be a motion.
Make a motion to update the county safely return to work policy.
Okay, we got a motion by Jim,
I'll second it.
second by Kevin. Any discussion?
Is the, so this obviously, when we see the end of to this pandemic, this will change to something different.
Hopefully disappear.
Yeah, or change to something drastically different.
Yes. I'm assuming that we will change it as the restrictions are lifted,
Mhm.
you know, maybe to travel being allowed or groups of 25, whatever the changes are. And that's why we knew when we made this policy that it was going to be a kind of a flexible policy, and we just wanted to update the board and you to approve that this would be okay.
Okay, we've got a motion to update the safely return to work policy.
Mr. Chair. Mr. Chair.
Yes, go ahead.
I think it's fine that we have to do this. I think it's a little redundant though, because it's mandated by someone not in this building. So I mean, I understand that we have to update it so that employees have clarity, but we don't really have a say in how this is.
Right. And I guess
Is
that
applied.
brings up a good point is, you know, as we go forward, do you want me to come to the board to update the policy, or do you want me to just send it out as Governor Walz changes the
Well, I think it's important for staff and public to know what's going on, but it's not really
Not a lot.
our choice as to how it's being changed or.
Well, I guess if we're going to enforce it, though, we need to probably approve it. Otherwise, you can't enforce it. If we change some sort of policy on this thing here, and you want to go, I mean, if you change something and you want to enforce it, that's sufficient, you know, or do we need, does it have to be county approved? So,
That's fine.
okay. Okay, we've got a motion to update this policy, the current policy that we got on board now. All in favor?
Aye.
Opposed? Motion passes. Thank you.
Just as a-
Anything further?
Does that mean that we need to wear a mask when we're not speaking? I mean, you are wearing masks when you're not speaking. What's the?
Yeah, the policy really isn't clear on that. It says if you're speaking. So I guess you could interpret that policy that everybody has a mask on until they have to speak. I know that you're all separated by 6 feet, which is also recommended. I might defer to my public health director to answer that. But I
Yeah,
know that's
and we got
covered.
direction from our administration too on,
Yeah, and that direction came after talking with Kathy. So,
We got a lot of direction around here.
Yeah, it was, it did mention in Governor Walz's information that certainly with, you know, when you're holding a meeting, public meeting, and you're needing to speak, and you're already social distancing, because oftentimes, as particularly with the board, you know, you're interjecting quite a bit and asking questions and speaking. So it'd be really, I think, challenging to put your mask on and off on a regular basis. So that's why I think what's happening here is just fine, because you're social distancing and you're holding a public meeting. In the policy, for people that are in their own office space and have no one in there, then we're saying they don't have to wear a mask because there's nobody in their office space and they're in their own space. But when they're out in the public areas is when we're saying to wear a mask. So
As long as we sit still, we're okay.
does that answer that question? Because I know it's like putting the mask on and off, and I did it when I was sitting here, but wouldn't be necessary if we're 6-foot distancing, we're in a public meeting.
Thank you for that update.
I just have a follow-up. Last week you asked on our benefits, on how we are doing this year, on when we made benefit changes. And so I went through August, and so far, the county has saved about $56,000.
oh, okay, that's based on that.
Based on
Yep.
a single.
Mhm.
Thank you.
It's about halfway through the year. Is
That
through
goes through
June?
August.
Well, it goes through August. We're not through August yet.
Well, we know who's getting
Oh.
benefits in August.
Okay.
Thank
So
you.
the next group will get benefits in September 1st.
So it's probably averaging slightly less than we
A
predicted.
little bit. We're hiring a lot of very.
I mean, this savings is tracking slightly less than what.
Do you have some more, Kathy?
Yeah, I wanted to clarify one thing, and I know it was confusing, but I'm not sure when we talk about children as exempt. So children who are 5 years old and under are actually under the exempt for wearing masks. Children that are 2 years old and under should never wear a mask. I wasn't sure if, I'm sorry, Darren, if you said that. I just wanted to make sure we understood that children 5 and under are exempt from wearing a mask. So, yeah.
So why don't we just say 5 and under, not wearing a mask?
Right, 5 and under, yeah, and that's actually what it says in here.
Yeah.
It does say 5 and under.
Very good.
2-year-olds never, 2 and under should never wear one, but 5-year-olds,
Good luck getting them
we
too.
put that, yeah, so it's 5 and under, period. Thank you.
All right, thank you. With that, we'll go into a proposed allocation of CARES Act dollars. Steve will take care of that one.
Good morning, Mr. Chair, Commissioners. As you are all well aware, last week this board approved a 6-prong approach for the allocations of our CARES Act dollars. We broke it into 6 categories of small business, community resilience, public health outreach and service, county infrastructure, county reimbursements for COVID-19 response, and small community allocations. And so as you recall, last week we had said we were going to continue to meet with our CARES Act committee and provide some tentative or potential funding for each of these different categories. And so just for your reminder, our CARES Act funding allotment for Clay County was $7,843,443. Cities and townships within Clay County that have citizens over 200 are also eligible to receive a direct funding allocation through the CARES Act. And cities and townships under 200 citizens are able to request funding for CARES eligible reimbursements through our county. The amount requested is based on a state formula, which allows for $75.34 by the number of people in a city, by their population, and also through the townships, it's $25 per citizen.
Steve, not to nitpick at all, but these background colors, I don't know if I am the only one that's, but if I'm the only one that's really blind and can't read any of that, that's in those boxes.
They show up really good on the the print off.
They do? Okay, then it's me,
Well, I mean, they show up better than they.
because I can still hardly read them on the printout.
Okay, we got that covered.
Okay.
All right. I think this is the only one that had this.
I think that's the only one.
Yeah.
Okay. Now,
Okay. And so just a reminder for our cities and our townships, they have through November 15th of this year to spend their allocations. And the county has till December 1st to spend their allocation. And at that point, the dollars have to be returned to the state.
The one question, excuse me, I don't, mean- and again, I think I asked it last week, checked too with the board, with the committee, just get the information out there on schools. I see the schools aren't listed here. I mean, and I know the school's got some funding.
Yep.
Can they get additional funding then, or is that,
Well, it's our understanding, a couple different things. The state allocated, initially Governor Walz provided $100 million for the schools. And then there's 2 additional funding mechanisms that they received funding for. And in talking with Matt Hilgarth from AMC, he's also indicated that Governor Walz will be providing additional money from the state, federal coronavirus dollars and put those towards the schools. And so we are going to touch a little bit on a way that we feel that we can work with the schools and based on some of their needs. But as part of our committee discussions, that's kind of what went into to some of those discussions pertaining to the schools.
Okay.
I think that we've talked a lot about the schools in this committee, so it's not that we're not aware of their need, but because they were allocated funds directly to the districts, and all the districts in Clay County received that. At this point, with what we're talking about specifically with these dollars, there are other areas that we think we'll focus that on, and I think we have some recommendations with how we can get the school districts additional funding for dollars that may not be allocated, but at this point, Moorhead received what, 1.2 million, several other districts 300,000, so there's a pretty substantial amount of money that they've already been allocated.
Okay, just wanted to make sure that the schools are aware that there's funding available. I'm sure, well, of course, I'm sure they are aware of that already, but I was just wondering about additional, because I look at schools as, they really got to make some modifications too, if they're not going to have in-school learning.
Yeah, and that's correct. One of the challenges about in our committee is working and trying to find trying to allocate the dollars that best fit the needs. And as Commissioner Mojo shared, one of the things that we looked at as a committee is what organizations have already had an opportunity to receive some funding and which ones haven't, and looking at those possibilities. So I don't think what to stand.
I think it's important to note that we've had conversations with every superintendent in the county. Because Steve has been in constant communication with them. Part of what we're doing now, and once we get to the community resiliency, maybe we can talk more about that, but identifying areas where we have existing partnerships with school districts, would it be helpful for us to strengthen those with CARES dollars? Would that be helpful to the districts? But I think your point is noted. They are, as many are, experiencing major change that will cost dollars to implement. So it's a difficult situation.
When it comes to the CARES category distribution, the state of Minnesota and the federal government is encouraging counties, cities, and townships who receive these direct allocations to identify the funding categories, which this board did last week. In addition, as I mentioned, they're also looking to provide an estimated dollar figure for each of those categories. Now, it's important to understand for the boards and the councils that this isn't necessarily a mandate. It's really the framework to which we would be operating off of in the event that there's additional needs in different categories as we go through this process. It certainly allows us the ability to shift those dollars to meet those needs. And so when we look at our categories, this is our funding breakdown that we'll be proposing today. We're going to go into a little more detail on each of these categories. But for our small business grant program, we're looking at $2.25 million. That would be for our small businesses. Within our community resilience, we'll go into more detail. We've put $750,000 into that program. Public health and outreach and service, $2 million. Our county infrastructure, 1.5. Our county reimbursements for our existing COVID-19 response of $1 million. And part of our $7.8 million allocation had $86,161 set aside for communities and townships that have less than 200 citizens.
Now, these funds, we're not just going to hand out these funds. Does everybody have to request the funds? I mean, like this $1,200 stimulus payment that everybody got, or pretty much everybody. I mean, that was just handed out without any documentation. But
correct, Mr. Chair. One of the things that the CARES Act are clear about is that we cannot do direct allocations to our citizens. what you're going to see today after this presentation is the first round of items that the committee is bringing forward to this board for approval. If there are in the townships and cities, communities that are under 200, there's a process to which they would have to go through to request funding from that small communities allocation.
Thank you.
So if you add up our category breakdown, that brings us to $7,586,161 with a remaining miscellaneous balance of $257,282. This dollar amount is having some sort of miscellaneous is strongly suggested, and we would be able to utilize those dollars to shift as a first round if we have additional needs in any of these categories.
Mr. Chair, while you're talking about shifting dollars too, one of the things that we need to keep in mind here is these numbers that the committee they're recommending as starting points. Throughout this process, we still need to be flexible in potentially moving dollars from one category to another. So just so you're aware of that we did our best to try to pinpoint an approximate dollar amount for right now.
So we'll kind of take a look at each of these categories in a little bit more detail, and our commissioners from our committee may have additional comments that they would like to make. And so our small business relief grant, again, is $2.25 million. And again, the goal of our relief grant is to provide assistance to those small business owners who've been experienced financial hardship as a result of the COVID pandemic. What we are looking at identifying as businesses are businesses with 2 to 20 full-time or full-time equivalent employees. They may receive up to $10,000 per application. We also are going to be looking at sole proprietors and limiting that to licensed daycares, which could include home daycares, and independent contractors that have established business locations. And they could receive up to $3,000 per application. And I think the important thing to understand is that we don't know for certain. We've done a great deal of research with our cities about the number of potential businesses within this framework, but we don't know necessarily how many people that will have application. So apply and be successful in the criteria. And so any financial allotments to each business will ultimately be determined by the number of approved applications by a deadline that will be coming. I do think it's important that we note that this is in the planning stages. We are working and trying to, in collaboration with the city of Moorhead and the cities within Clay County, and working towards a one-step application process that will hopefully lead to less confusion and less stress on our business owners who already have had a number of challenges.
Our hope, Mr. Chair, is that it will be an online application with parameters, and as long as you meet the parameters and are able to show the financial hardship as a result, that will be a complete application that will move forward for review.
So is that on the website already? Or
Not quite. We're hoping, hopefully in 2 weeks, I think, is a pretty good goal. But because of the deadline of December 1st, it really is something that we need to launch swiftly to get the money to the small businesses that need it most.
Okay. Any other comments, commissioners, on the business piece? If not, the second.
I guess if I could. So, I think Steve kind of hit on here where, we have these numbers where it says up to 10,000 for businesses and up to 3,000 for sole proprietors. I think, and the reason that is that it's all going to be dependent on the number of applicants that we have countywide for these businesses. So if we have a great number of businesses that would qualify, then, for the money that we have put into that pool, when that money runs out, it runs out. So we don't, it's not necessarily a first come, first serve type of a situation here. It's everybody who applies within the time frame, they're gonna all qualify to get an equal amount, is kind of what we're looking at.
Yep, Mr. Chair and Commissioner Campbell, as he touched on, one of the things that, as part of this process and working with our cities, what we're working on establishing is a committee who will review these. So it won't be just staff from Moorhead or staff from Clay County. It will be well, the plan will be that we'll have a number of different people from our communities going through these documents.
And I think it really shows it's a strong partnership with the leadership in the other cities. We are all committed to positively affecting these businesses in Clay County and treating them all the same, and we are really committed to making sure that that comes to fruition, and by doing so, that will allow cities to use the allotment of CARES funds that they received to go to other services within their cities that they may have needs for.
Well, I think handing out, not free money, but handing out money, sometimes tougher than trying to hold down a budget or something like that, you know, so you guys do have a difficult, you're probably going to be in difficult decisions as far as who to give the money to, you know, so.
For instance, let's say you have a business and your only establishment in your business is a Facebook page and a cell phone number. Are you going to qualify for this?
You're not. There will be. We're working on a definition of what a business is, and as we mentioned here in the previous slide, right now licensed daycares and independent contractors are the sole proprietor focus that we're going to be looking at.
Yeah, and again, just to clarify, that even on the independent contractor, we're kind of going by the same thing that the deed application had beforehand, and that is where they actually have to have an established business residence, not working out of home. The only one that qualifies for working out of home are daycares. That's under our current discussion how we're dealing with that. So, but if you have an office, you're renting an office in downtown Moorhead or downtown Barnesville or Hawley or whatever, that would qualify you.
I think it's important to note there are some pretty good standards set forth by Minnesota Management and Budget and the Treasury Office, and so that's part of why we're not recreating the wheel. We're basically going with how they did their deed grants this earlier round. If you receive those deed grants, you're not going to receive additional COVID funding in this round, definitely, but there's some pretty good set of standards. You have to be in good standing on the taxes and Department of the Auditor's Office as well.
We're using some of their qualifying standards.
Good.
And just to kind of put it in perspective, I think the last, one of the goals of using the deed applications from the most recent application process was, again, not to put additional burden on our businesses. For the funding that was available, there was about 27,000 applicants, which in our region, about 250 grants were provided. And so our hope is those businesses that utilize that process before, it'll be a matter of resubmitting that, and they won't have to put a great deal of work into getting that information.
Let's see, Jenny made an interesting comment there. She said you have to be in good standing, excuse me. So if I'm back on my taxes, I'm behind on my taxes, can I apply to get some money for paying my taxes?
No.
No, the state has a list that we're able to access for all the counties, all the businesses that are in good standing, and if you're not in good standing, that would preclude you from getting the grant.
Okay, thank you.
The next portion, the next category that we're looking at is community resilience. And the first area that we want to touch on is some of the different counties that as they've set up their categories included within their business program, both the businesses and nonprofits. The committee has chosen to break the nonprofits out, and we're looking to allocate of the $750,000. We're looking to allocate $250,000, and again up to $10,000 per application. But we're only looking to make this available to 501c3 businesses and 501c19s. And the 501c3 is the IRS code that considers federal exemptions for public charities, private foundations, or private operating foundations. And the 50C19 deals with the IRS federal exemptions for veterans organizations. And again, the allocations will ultimately be determined on the number of approved applications. If there are not enough applications, again, those would be an opportunity to move funding dollars into other program categories. Some of the other things that we're looking at breaking down the remaining $500,000 are emergency assistance program, school-based mental health, and community-based mental health. And I think that what we spoke earlier on Mr. Chair's question about school is looking if there's a way that we can provide some additional dollars to meet the needs of the schools for those kids who aren't able to get to school to provide that service, if there's a way that we can reach out in that fashion. And so, again, you know, some of the challenges that we find is that this is a fairly large undertaking, and some of these pieces within these categories we're still in the process of finding additional solid grounds here. We're looking at in these cases particularly, you know, we may look to partnering with different agencies in the community who are better served to provide those.
Yeah, I think through those independent agents, you know, Lakeland Mental Health comes to mind, and Community Action, Lakes and Prairies. But I think what we talked about there would be, you know, on the school-based mental health, probably starting with our own public health department and our own social service departments. They're the ones, they currently do work with schools in those areas, and so that's where we're probably look to start. And again, those are that's next rounds of meetings that we have scheduled. I think some are this afternoon.
Yes.
Dealing with those exact issues. So it's kind of still a planning process, but.
But we wanted to make sure that you're aware of where the conversations are going and how we can address all of the needs that we're seeing in the community.
The next category is public health, outreach, and service. We've provided $2 million here, and again, certainly Kathy and her staff have really led the response to the COVID pandemic over the last 5 to 6 months through the guidance and direction from the CDC and the Minnesota Health Department. And part of our committee, we really feel that, you know, in addition to the $750,000, that this $2 million is really an extension of our community resilience. The needs of our community are going to be high over the next number of months, and through community education and outreach, testing, contact tracing, case investigation, and are really areas that we think are going to reach out to our citizens here in Clay County. And again, there'll be some additional equipment that will be necessary to respond to the pandemic as we move forward. So, any questions or comments there?
Again, I think we need to be careful that we don't underfund this one, and I think that, you know, so we're cautiously optimistic that the $2 million will be there, but that's the front lines in fighting the pandemic, and so we got to make sure that we're putting adequate dollars there. So.
The next area that we're addressing is county infrastructure, and that's $1.5 million. Today you're going to have a number of board agenda items in this area. The first area that we'll talk about is information technology. We want to make sure that we have the proper remote work infrastructure capabilities. Tim, and we'll touch with Tim here a little bit later, his staff did an excellent job moving from a no work remote policy until getting our staff out to follow executive orders.
And we made a number of initial investments to get the entry-level infrastructure that we need, but we'll have some additional needs that in the event that this is obviously going longer than just a few weeks or a few months, that we're able to prepare to keep meeting the needs of our citizens, no matter what issues that we're facing. And also, we're looking at COVID-19 compliant facilities. We want to make sure that we're having adequate social distancing within our buildings for the protection of both our employees and our citizens. We want to look at limiting the spread through operations of operating practices campus-wide, having windows or plexiglass, touchscreen, things within bathrooms and water fountains are an area. And then also just doing due diligence on evaluating our campus buildings as a whole. Motor vehicle, for example, we have right now in the summer, if you go by the motor vehicle at 7:45, there are a number of people who are waiting to get in. And sometimes those waits can be in between an hour to 2 hours. And so that may work most days if it's not raining here, but in a few months that might be a little bit of a challenge. So we want to evaluate things like that within the campus to make sure that we're meeting the needs of our citizens. And again, the things that we have listed on this slide aren't necessarily things that we're going to be all able to do or capable of doing with the funding that we have, but some of the things that we're just evaluating and doing our due diligence as we move forward.
I noticed that further on our agenda today, there's requests for funding for some of this stuff. Should they be going through us, or should they be going through the CARES committee first?
They've
They
already
have
gone
been.
through. Yep,
Oh,
their
yeah.
The issues,
recommendations.
yep,
Very good.
the
Thank
items
you.
that will come forward to this board will have been vetted by the committee.
Those are recommendations from the committee.
Thank you.
Move forward. Any questions on the infrastructure?
I think the biggest thing, I apologize, in this new day and age, the most important thing from my perspective is that the services to the citizens are able to continue at the highest quality possible. And so COVID restrictions have really changed how service is delivered, and part of what we're trying to address in this area is citizen input and citizen engagement going forward, making sure that citizens have full transparency into how decisions are being made, but also are able to connect with staff to have services.
Our fifth category is county incurred COVID-19 expenses. Obviously, through this process, starting back in March 1st, the CARES Act dollars start at that point. We've had a number of COVID-related wage and overtime costs in dealing with this, specifically in public health, social services, law enforcement. We've had to spend a great deal of money on personal protective equipment and PPE, hand sanitizer. Cleaning of our campus happens multiple times per day, and so those are additional costs there. And then we've also had other costs related to COVID signage, the initial plexiglass that we provided. And so again, we will be able to have the county incurred, and also things that we're moving forward here through December 1st. We're looking to capture here within this category. And lastly, we have our small communities. Again, we've provided $86,161. Again, that wasn't our allocation, that was based on the state formula. Cities and townships under 200 people have the ability to request through the county coronavirus fund, small city townships and expense reimbursement certification form, and that would come to our committee, which we would then make the determination if they met that criteria and bring that forward for payments. Again, as we mentioned, we've tried to have open dialogue with our cities and our townships and school districts through this process. On your desk, you should have a letter that came out of our committee that we would be looking to send to our cities and townships. just again reminding them of the the CARES Act funding, and also some of the process that they would need to go through. Commissioner Campbell mentioned again that these are their funds, and so we certainly don't want to tell cities and townships how to spend their dollars no more than we would want anybody to do that to us from that standpoint. But one of the things that we're in the letter, what we're encouraging them is if they have additional dollars or they don't have necessarily expenses related to COVID, that they still apply for the dollars. And as their first pieces look to their communities, their Clay County school districts, potentially their emergency management, and look at possible collaborations of funding through those different agencies. And again, at the end of the day, if they don't wish to manage their allocations, we provided them a resolution that they could utilize to turn those funds over to Clay County. They're required to do that. The direct allocation, cities and townships are going to be required again by November 15th to turn over any unspent dollars to the county. But there's an example that they could utilize if they wish to do that.
And again, all of these, I think there's a number of small cities that got direct payments to them. Well, they will if they sign this certified letter.
Yep.
And they will get those dollar amounts, but they still have to be spent on qualifying expenditures. And some of them may or may not have that, and that's where if they don't, I think we're kind of encouraging to, and that goes to Commissioner Gross, one of the things you're talking about school districts. That might be a good opportunity for them to say, well, if we don't have any qualifying expenditures within our small city, our school district might. And so, so that's where we're trying to get some collaboration going. The same with the emergency services department, whether it's in Ulen or what have you. So Sabin, any of those places that could probably use, that right now aren't getting any direct payments, that could probably use it. So.
The township funding total is approximately $147,000, I believe, for Clay County.
Yeah, and I think in the conversations that I've had, many of our townships haven't been meeting during the pandemic, and so a lot of them haven't incurred necessarily any costs, and so that's why we're encouraging them to one, apply, and two, look for those collaborative opportunities to ensure that even if they may not have it within their township, that those dollars stay here in Clay County and don't go back to the state on December 1st.
I know that Gabe is going to be, working pretty hard with those townships and small cities to kind of help educate them on what their options are.
And so I again, just we kind of touched on this slide already. And so I guess with that, I would stand for any questions or any further discussion.
Any questions for Steve? All right. Do we need to approve this?
We would be requesting today to have a motion to approve the proposed funding categories with the understanding again that there's going to be flexibility in that, but providing the framework for us to move forward as a committee.
Good job from the committee, thank you.
Mr. Chairman, I'll make a motion to approve that. Approval of proposed allocation of CARES Act dollars.
Second.
Okay, we got a first by Jim, second by Kevin to approve the proposed allocation of CARES Act dollars. Any further discussion?
And I want to reckon to, our committee that's been involved with that. We got some here today, Lori and Brian and Kathy McKay, Darren have been part of this, and of course the incredible amount of work that Steve has done in doing all of this, coordinating all of this, and this has been quite a task. When you're limited to time.
Yeah, I think you got some time constraints. Like I said before, when you're handing out some money, it's a tough job. It's almost tougher than taking away some money. Okay, we got a motion to approve this. All in favor?
Aye.
Aye.
Opposed? Motion passes.
Thank you,
Thank
Mr.
you,
Chair,
guys.
Commissioners.
Steve, did you want, is that coming later, this letter? Or do you want?
We could address it. If you, I mentioned the letter that that came out of committee to address our cities and townships. Again, we've had open dialogue, but we have a letter before you that we talked about that we would like to send out. And so, yeah, if would behoove the board to make a motion to approve that, we would get that out today.
Well, I certainly always prefer a letter that's a one-page simple thing here and not too lengthy. However, under all the conditions we have here, it takes that much to explain this. So I think it's a well done letter, and I would move that we send this.
Okay, I noticed that this is a resolution. Is that, are we making a resolution on this?
Yeah.
It's a excuse me, Mr. Chair. It's a resolution to provide to them should they want to transfer the funds.
Yeah, I don't know what the resolution number is, but whichever next one.
But it's not for us.
It wouldn't be
It
for
would be for
us,
the
yeah.
individual municipalities to act on. So it's a framework for them to use if they
Oh,
want.
excuse me,
Yeah,
okay.
this would be their resolution
Thank you.
to us.
Thanks for
It's a
updating me on
proposed
that.
resolution.
Sorry about that.
That's okay.
Okay, we got a motion by somebody.
Me.
Jim, thank you.
Second.
And a second by Kevin to send this letter out to our Clay County cities and townships. Any further discussion? All in favor?
Aye.
Opposed? Okay, motion passes.
Thank you.
Thank you.
Okay. With that, we'll go into request remote work infrastructure. With Tim Dent coming with some request.
Before Tim says anything, I just want to say that the heavy lift that your department experienced when our remote policy changed was enormous, and we are thankful for the work that you incurred. But it does not also go unnoticed to me that the request today is almost a third of what your annual operating budget is. And so just so the public kind of can understand what a huge task this is, I think it's fitting really that this is the first item for the CARES Act dollars that we're acting on. It's definitely justified in my book, so.
And I would agree, and I would add to that although there's been an awful lot of discomfort in this process and staff time and everything, there's some underlying good that can come out of it. We've learned an awful lot, and we've learned about abilities to work in different ways and go about things in different ways, and that could have some long-term, very positive opportunities for us as a county. And so, and I think, Tim, with what you're proposing here and why we're so supportive of this recommendation is exactly that. It's not only for taking care of now, but how we do business in the future. So this is really an exciting point, I think, for me.
Yeah, absolutely. Okay, this is a request of remote work infrastructure. We probably covered that, Jenny and Kevin probably covered that good enough, giving you all kinds of recommendations to move ahead with this. Do we need to discuss it any further? But, okay, let's go on. Tim, what do you got?
Well, like Steve said earlier, what our goal with this funding is to improve our mobile workforce infrastructure. And we keep building upon what we've already done this year by purchasing additional hardware, software, and supplies to accomplish that goal.
Okay. Now we're looking at laptops, docking stations, furniture, headsets, webcams, all kinds of miscellaneous supplies, so.
Correct.
And this is all, so people can work from home. Now we could continue this after the COVID too, couldn't we?
That's precisely what I was getting
Yes,
at.
absolutely.
Yeah.
I think
It's kind of a change, like Kevin said, we, moving away from the, permanent desktop setups at people's desks where you have a laptop there instead, they work from their laptop. And possibly you can get away from the phone, because obviously when an employee goes home, they can't take their telephone home with them. But with some of the enhancements that we made and some additional licensing that we need, the user can plug a headset into a laptop and they'll be using their phone as they would back in the office. We eliminate that phone completely. They could be at home and their phone would look like it's their number at work. They wouldn't have to use their own landline or cell phone.
Is there some tracking available on this stuff that they show whether they are on the computer or not, or?
Not at this point. That is one of the items that are on our list. Some management software for the remote workers.
Okay.
That's part of what we've been requesting to have the research done. And again, I think we have some opportunities here to, as I talked about before, change the way we do business and also change what we invest in bricks and mortar. You know, we can see some real opportunities to make some reductions in that respect by going this route, and I think that's good for our staff to be working in the way that they want to, and it's good for our citizens. So I'm excited about this one.
And part of the reason we're addressing this first is that there's a short supply, and it's an enormous order, and we need to spend it.
It takes a while to get.
It'll take a while to make sure everything is up to date.
Okay.
I guess I will offer a motion to approve $534,900 to purchase technology to ensure that Clay County has the appropriate infrastructure for remote capabilities.
And I will second that, which is the caveat that this comes out of the county infrastructure bubble, if you want to call it that. Or,
CARES Act fund.
Yeah, CARES Act dollars.
Okay, we got a motion to purchase some infrastructure for continue working from home. And a motion by Jenny, second by Kevin. Any further discussion?
I would note, Mr. Chair, that in working with the vendors, our goal is that Tim is going to work with a local vendor, and so not only is it going to be a benefit to our taxpayers as part of what Commissioner Campbell spoke, but also investing in our community business. So.
Excellent. Excellent.
All in favor?
Aye.
Aye. Opposed? Okay. Very good.
Thank you.
Thank you, Tim, for your work. Okay, with that, we'll go on to replace existing toilets, faucets, and bottle filling stations on campus. We're getting a little bit behind, so you got 1 minute to go. Okay?
I'll be quick.
Morning.
Morning there, Joe.
As we kind of mentioned earlier today, you know, providing for the health and safety of our employees and our citizens is a high priority, and I know a high priority of this board. And so one of the areas that we've looked into, asked Joe to look into as a committee, was looking at the items that you brought forward, Commissioner, Mr. Chair. And so what we asked Joe to do was to go out and to look for 2 quotes, and he has those presented here today this morning.
Yeah, so basically what I did is I reached out to a couple different contractors, and we, as you can see, there's a difference between the two as far as price to replace the fixtures of the sinks, the toilets, the urinals, and the water fountains in all the proposed buildings that are on here.
Excuse me, Joe, does that include the highway department building?
Yep, that includes the highway department.
Would other people, I mean, if we do the highway department building, that would involve other agencies.
Yep, yeah, I did reach out to Dave and talk to him a little bit about that as far as us replacing it. I think, what did you have? 5 sinks, 6 toilets, and 2 urinals, and 4 water fountains. So there's a little cost there But I was gonna work with Dave on that and see exactly if there's a split on how that works, so.
Okay.
So,
Sorry for
but
interrupting.
to get the quotes and everything moving, I just put that in there.
Okay.
So, but yeah, so, basically, Grants Mechanical came in at 190,152, and Dakota Plains came in at 170,500. There's a little difference, but both companies were given the same fixture that I was requiring. It's kind of it's not the most expensive, but it's the middle of the road, a real decent fixture, so, so they both, that's what I have here, so I guess I would request.
Joe, I have to ask this question. So I got my packet and I saw this, and at the time, Dakota Plains Mechanical didn't have a number in it at the time that I got my packet.
Yep.
Did you receive that quote from Dakota Plains Mechanical before this went public?
Oh, yeah.
Okay, I just-
In fact, last week is when I reached out to both companies at the same time, and grants came in before, and Dakota Plains just got theirs, and I guess they sent it a few days ago, so neither one of them knew.
Okay, I just want to make sure that one didn't know what the other one's quote was.
No, today is the first day that we're reading these numbers
Okay.
to these, so.
Okay, is this involve the replacement too? I mean, or is this involve the cost of the fixtures?
Yeah, you're just gonna replace the fixtures, not the actual like sink or the toilets.
Who's gonna do the replacement?
The contractor is here.
Okay.
Under this amount.
Very good.
Yep,
Okay.
so this is to include the fixtures and the replacement. So one other thing I wanted to note at the end, though, there may be a little bit more cost to, not a whole lot, I don't believe, but, with all these areas, and when we get into shutting water off, there's a valve here, it might not hold, or here and there, so there may be a little bit of extra cost, but not anything I don't think's real big, but wanted to make that note that, we hadn't had a chance to go and look in every ceiling tile and check everything out with all these fixtures, but it shouldn't be too much.
I have a question.
Okay, just a minute. Jim?
When the CDC recommends that you wash your hands with hot water for 20 seconds to prevent the spread of COVID-19,
Yep.
when you have these automatic faucets and you flash your hand in front of the sensor, it goes off for approximately 3 seconds before it turns off.
Yeah.
And it's still cold after
Yeah.
the end of 3 seconds. So then you have to sit there and keep hitting it about 8 to 10 times before hot water finally comes on, and then
Yep.
wash your hands another 8 to 10 times to get to 20 seconds.
Yeah.
Is
Yeah.
it programmable so that you don't have to do that?
Right, you can set the sensor time for the run time on it.
To get to the point where
To
it's
get
hot
to the
water
point
coming.
where it's hot water and it's,
Okay.
yeah, so we'll make sure that all of them are set, so it's not that 5 seconds.
Very frustrating when that happens.
Yes, I agree, so, yep. But when we install it, I'll make sure that run time is.
And then the toilets will have enough water programmed in them so they will flush the first time.
Yep,
Yeah.
yep, exactly. It'll be the same flush there, just, yeah, same amount of water flowing through, so. These are all battery operated, so, you may see a little bit extra on batteries per year. Usually the battery they last about a year or so. They're easy to change. You may see a reduction in cost from what I'm hearing in the water portion of this. But,
Mr. Chair, these were, once again, these were recommendations from the CARES Act Committee to move forward. Also would fall under the bubble of the county infrastructure category. So I would move that we go with the low quote.
Okay, we got excuse me. Got a motion to go ahead with all the replacement of the fixtures, bathroom fixtures.
Second.
And second by Jim. Any further discussion? All in favor?
Aye.
Opposed? Okay.
Thank you.
just to note, the fixtures take about a month to 5 weeks to come, so we'll start doing this within that time probably, so. Everybody wants these now.
Thank you.
Very good, Joe.
George, good.
Okay, next thing we got the request approval to allow Commissioners Campbell, Mojo, to authorize purchases for Federal CARES Act dollars up to $50,000.
We do, we have one other one before that, Mr. Chair.
Oh,
Of,
yeah.
Georgia. Georgia.
Excuse me, Georgia. Come on in. Jumped over one there.
We were requested also to put a list together of our needs with the custodial staff. And even though the buildings have sometimes been less populated with the staff in there, it's given the existing custodial staff time to do some extra sanitizing and cleaning. However, we are looking at the overall building, so we're looking for hand soap dispensers, toilet seat liners, the Saniseat supplies, which are the automatic touch-free toilet seat wraps, and then the sanitizer misting. We put in 7. We originally were thinking at 5, 1 for each building, but with the Family Service Center being larger, we're proposing 2 in that building and then 1 for backup. And of course, these items too will have ongoing expenses for the sanitizing supplies of the equipment and batteries, which is not included in the quote. The one startup would be, but after that there will be ongoing. At the bottom where I indicated there's electrical, for these items we are proposing there wouldn't be any electrical needs.
Mr. Chair?
Yes.
So, Georgia, so these are what you're anticipating between now and the end of the year, is that correct?
Correct.
So what you have done from March to now will be handled differently?
Right.
That's going to go in the county reimbursement bubble, whereas this is coming out of county infrastructure?
Right.
Okay, just again, that's
For our
just...
hand sanitizers that are all throughout the building, that comes out of Gabe's request for
Yep.
reimbursement.
Okay.
This would be all new equipment and supplies that we don't currently have.
Will these Saniseats create extra waste paper
I'm
waste
guessing
in
they
the
would.
bathrooms?
They, not in the restroom itself, it's a container.
Okay.
Where it comes in a roll, it sits on the back of the toilet, it'll
And-
roll itself and it'll end up on this side, so they would take the whole roll out. I'm guessing it may create some
Okay.
extra work, if there's jamming or things like that.
Okay.
But overall, it should save on some time.
Okay, thank you.
I'm just looking at these supplies that you're ordering, that's just for this year, I take it. Or, what's gonna happen next year?
Well,
That's just gonna have to be fit into the budget then, for the
Correct.
replacement of some of these supplies?
Correct. The majority are fixtures, so it's just an automatic hand soap dispenser where right now we have to pump it. So there'll be a sensor in there, you just put your hand under it and you'll automatically get it. So the product may change, but we're still gonna need the existing products that we're currently using now. We will see an increase in the rolling for the sanitizing for the seat dispensers. And we'll be changing our product for the mister type of gun, but it will be the same type of a sanitizer. It'll just be a different product that we'll have to put in it for sanitizing. Overall, we could see some savings from, the paper products. Right now, when we sanitize, you need a rag to wipe. Sometimes with these misters, you just spray in there and it's better to let it evaporate.
Looks to me like we're gonna keep someone in business for batteries for a long time.
Unfortunately, we are.
Joe's
will be an ongoing
stuff
expense.
takes batteries, your stuff takes batteries, so, okay.
And Mr. Chair, as we mentioned earlier, right now, on any given day, our custodial crew is going through our county campus 2 to 3 times. And so from an efficiency standpoint, desanitizing guns, for a better point, will be extremely helpful in getting through our campuses.
This is minor in compared to what we're looking at as a whole. Are there the hand dryers, do we have automatic hand dryers in every bathroom?
Not in every location.
Okay.
Steve maybe wants to speak a little bit more. But there was a public health concern. In our main lobby of the Family Service Center, I think there's one in each location, but the rest of the building, I don't believe has any. And we've kind of gotten away from that.
We initially we had this up for discussion as part of this request. In talking with Kathy, the CDC and MDH does not recommend paper towels are still the preferred method of drying hands.
Mr. Chair, I would move that we move forward with the authorization of these items.
Okay, we got a motion by Kevin to move forward with the authorization of some supplies for the custodial.
I'll second.
A second by Jim. Any further discussion? All in favor?
Aye.
Opposed? Okay.
Thank you.
And now we'll go into that thing I already said we're gonna do.
Thank you, Mr. Chair. I think that, as we've spoke through this process, there's a lot of time sensitivity on some of the different items that we may need to purchase during this time. There are a lot of different agencies that are vying for the needs out there, and there may be times where it would be beneficial for us to be able to make a purchase in between a board meeting. And so the request before you this morning would be to allow Commissioner Campbell and Commissioner Mojo to act on behalf of the board to spend up to $50,000 on a purchase prior to receiving board approval. We do have a protocol that we've seen this similarly done with our juvenile center and our law enforcement center building committees. Commissioner Whalen and Commissioner Campbell were allowed to do this in that case. At that point, it was up to $25,000. But given the time frame that we're looking at, the committee felt that requesting up to $50,000 would be more appropriate.
And it's not either or, it's both of us agreeing.
Correct.
That's kind of,
Okay, does that have to be, if they approve it, if we give them approval up to 50,000, does that have to be brought before the council then, or is that?
It will still be
It'll
brought
still
before
come
the
before-
board as
yeah.
part of the normal billing, the state bills each board meeting.
Okay, very good.
Mr. Chairman, I'd like to make a motion to grant permission.
Okay, we've got a motion to grant permission to allow up to 50,000 approval by Commissioner Campbell, Commissioner Mojo. Do we have a second? I'll second it. Sort of looking at you guys, but you're involved. Speak up if you want. No, okay. A motion by Jim, second by myself, to approve the $50,000 category. All in favor?
aye.
Aye.
Opposed? Okay. Let's see. Moving right along here. Our annual budget presentation. Georgia, you're gonna do that one, huh? We're gonna do our budget presentation for the Building Maintenance and Family Service Center. You should have a copy of that in front of you, I think. Did we get a copy of that? Oh, yeah, Building Maintenance, okay.
There it is. Bottom of the stack.
Okay, I have just a few different sections within the Family Service Center. Overall, all three of the areas are remaining very close to the same. I'm not sure what page you have that you're looking at, but the first line I have is 65,038, 5,400.
Are you on the Family Service Center or the?
Yes, Family
Okay,
Service Center.
thank you.
And the first line, and again, unless you want me to go through each individual one, the very first line is our copies and postage, and obviously with paper reduction and people get away from copying, our income is a little bit less on that. We do charge 7% on our postage that we get reimbursement from, which we charge out to other departments and tenants within the building. The next line, we're actually gonna have an increase. That's 50% of that mail position that I recently brought to the board. They were a variable hour and we combined it into a full-time position. And we're gonna get reimbursement from social services because they do work in there 4 hours of the day for 50% of the salary and benefits. Overall, going down, everything pretty much is remaining the same. The salary in there would be for that same employee. The postage is at $150,000. We may see an increase in that this current year with the election stuff. We are doing a lot of mailing of ballots, so that may increase for this year, but again, it would be a decrease in the next. Otherwise, everything pretty much remains the same. And that portion, the next line, the 65039 building manager, that's my budget, and that will remain the same except for, there's one step increase for next year in 2021. The next page I have is the auditing and accounting. That comes from the state audit portion. And then the 65-111, 5400. Those are paper expenses that we charge out and get reimbursement from. So it's just kind of a payback to the account. That next line of 5838, you're gonna see a decrease in there. We used to provide custodial cleaning for the juvenile staff. In their building, they have currently taken over all the custodial duties. And so we do not invoice them obviously for any of the cleaning. And then as far as the expenses, and Joel's probably gonna touch on that too, we used to divide the expenses at the end of the year for the joint equipment that the Family Service Center and the juvenile share. Now he breaks it down per each building, so it's charged out in the expenses below, so you won't see that reimbursement. It's actually just charged right to their budget. There's a little bit of a change in the salaries for 65-111, 60-105. What they did is they combined the salaries from the salaries variable hour part-time into the full-time, and then we also realigned some of the maintenance staff, which is Joe's staff. So you'll see a little bit of a increase there, and of course decrease below. Just going down the list, unless you have questions, everything else is pretty much remaining the same as it has in the past years. So that little bit of an increase is really overall due to the transfer of staff within the maintenance department.
I just have a question quick on the building insurance. The 20% increase on that?
Which number was that? I'm sorry.
6351.
Correct.
I guess I'm not real sure on that one. Do you know on that one? Glenn?
Just go by actual.
Yeah, so it would just, I guess on mine, I don't have,
Okay.
We just put the 2,500, the actual in there. But it's showing a 20.13 increase. I'm not sure why that number is in there.
Yeah, I mean, it went from 2019, 1264 to this year, it's 2498.
We have had, unfortunately, quite a few claims. I'm guessing that's probably maybe what increased the, but we've had several water damage claims, unfortunately.
The detox one was a pretty big
Yeah.
claim on that.
Other than that, it's pretty much remaining about the same. Slight increase, couple percent overall. The next page, the 65-805, I guess the larger one is the Family Service Center rent. That's gonna go up slightly. We did not do an overall increase of the rent this year, or proposing for next year. In 2022, we are proposing an overall increase. Although the building is full, the slight increase in the rent is coming from two of the tenants that received a reduced rate, and we're getting them up to the actual fixed rate. So that's why there is a slight increase proposed for next year. Workman's comp, I guess those things are things we don't have any choice on. And any questions?
All right, I'll touch on my portion of the budget here. I'll kind of hit the highlights of it. Basically, my budget's tracking the operating expenses for maintenance on the courthouse, the jail, the DMV, law enforcement center, and the power plant, all kind of wrapped into one budget. So basically, the only, I guess, the source of revenue we have is at the DMV. That's remaining the same right now, so nothing's really changing much there. Other than the salaries, Georgia touched on that a little bit. We're realigning my maintenance staff. I think we're charging a portion of my 40% to the Family Service Center, and the rest is to this budget. So there was a little realignment there, but Other than that, the lines that did increase, we requested to raise the lawn supplies from 5,000 to 12,000. And we're seeing now with the new campus that just between the trees and the dirt work and everything, there's a little fix-it list every spring that costs money now with some curbs get broken or whatever. So we're requesting to up that to 12,000 on the lawn supply end of it there. But other than that, there's not a whole lot of other changes there. Under the law enforcement center custodial line, we are proposing to drop that $5,000. I think George dialed in on how much it costs per year to do that, so that's a decrease there. In the jail one, the custodial line, Julie, I think, mentioned last week that I think between me and Georgia and Julie and Justin, we'll all have needs out of that line, but she's going to be tracking it, and so we felt it was best to shift the $15,000 that we proposed in my budget, or in our budget, over to Julie. So you'll see that $15,000 shift from this budget to hers, to add into what she feels she needs for her stuff. So the equipment repair and maintenance line under the jail, that's a significant increase we're asking for, to take it from $10,000 to $30,000. The reason being is, in talking with Julie, initially we had planned a $10,000 for maintenance and contracts and stuff, but between now, we're finding between the equipment stuff, contracts, and she has it, I'm budgeting for all her kitchen appliances and her laundry stuff too. Anything that happens within that kitchen is going to be within this budget. She's internal serviced for if we need to replace these equipment, but anything that happens, if a dryer breaks down or whatever, we're asked. So basically, this is the total operating budget for any equipment in that building. So that's why that increase went up to that. Other than that, the internal services fund within this budget, it's going to be a separate item, but we're proposing to come back and upgrade our tractor this year. Last time we upgraded was 2016, and we're coming back to ask for it. We feel we need a little bit better, I guess, commercial grade style type thing for our snow removal, and during the summer too. So we'll be coming as a separate, Tab was going to take that to the building committee. So, but just wanted to note there may be some money that we're proposing to spend out of that, but we have enough budgeted there. So other than that, it's not in here, but Fund 19, just to note, that's our building improvement fund. So we're looking pretty good there. We're proposed to add another $100,000 into that, and that's the boiler project's wrapping up. That went well. We didn't have any extra cost on that. So Fund 13 is the carpet and paint. We're going to transfer $50,000, although we don't really have we're kind of on hold for carpet and paint until we figure out what we do there. So other than that, there's just some highlights. Any questions? Yeah.
I just have a question, Joe, in terms of snow removal.
Yep.
I know the last couple years have been crazy.
Yep.
I see you've only got 50,000 budgeted, and
Yep.
we've already used 32,000 of that for this year.
Yeah, I think we're okay, because that was a really heavy. This was the heaviest. I mean, not the heaviest, but it was
Right.
a really heavy winter.
Right.
So we did increase, like say last year, we increased it 15 grand, and I think we're sitting good. If we have a really heavy fall, we might over, but I'm thinking
I guess
it's okay.
Just my thought, and
Yeah.
you run a pretty accurate budget, so I appreciate that. But
Yeah.
we did add the law enforcement center, and that's a little more. And
Yeah.
when it was down, you were only using, you still used 41,000, and the budget was 39. So
Yeah.
I think that you're close, but I
Mhm.
just that's not an area we really want to
Short ourselves.
ourselves on.
Yep.
Specifically. So
Yeah,
just
and
watch
just
that.
to note in hers too, and Georgia also has a line item for snow removal. We upped that last year too, a little bit. It's not really covering the cost of that extra parking lot and stuff, but yeah, we can certainly adjust that a little bit if just to see, but.
Well, I think you definitely have the historical numbers to kind of follow. But
Yeah.
we did add some more area.
Yeah.
And like you say,
Yeah, that heavy winter with the new with the new stuff, with the new area, it really gave me a good idea, at least what it cost this winter.
Yeah, okay, thanks.
So,
I just wanted to note one other quick thing on the budget as far as the building repair and maintenance. We agreed and we brought it to our building committee once we were looking at the capital buildings and where the future of the building is. There's still repairs that are needed in the building, and I think Joe would attest to it, that there's money to cover those expenses, but if we were looking at overall doing the air conditioning where we're having issues, those we have not included in that. We've still put those items on hold until we see the direction of the future for where the buildings go. But the needs are still there.
yeah, yep.
Well, since we're gonna maintain that, we're gonna keep that building, as far as I know, don't we have to fix that stuff, or?
Yeah, we, right now we're maintaining it, but there are some bigger items that we feel we have we know down the line we have some big costs coming within the next 5 years. But I think George and I are just kind of seeing how this whole master plan campus thing plays out before we invest dollars into that. So we're not falling apart or anything, but I think we know we do have some planning that we should start planning for within the next 5 years. So not immediate needs, but has to happen.
That was, when we had our, like I said, the master planning, our campus committee, and we just kind of put those same items on hold. The needs will be there, but obviously they aren't in this budget. We're just waiting to see the direction for the future.
Yeah.
Well, if we got everybody working from home, we won't need air conditioning and heating, right?
Kind of a big 10-4 there.
Yeah, okay.
Thank you.
Thank you.
Just a thought. You don't have to implement that. Okay, scheduled for a break here. We'll take a short break here. Get back online here. What are we gonna do next here? Dave is here. Dave, we're gonna be purchasing a trailer.
Good morning.
Good morning, Dave.
There is some additional equipment that MnDOT has put up for sale, and our staff took a look at it. They drove down, and the first round that we got notified on, we actually kind of missed out on. And what we're interested in is a little upgrade of a used skid steer trailer. So our guys took a look at the first one they emailed out, and it had already sold, but there's an additional one coming right behind it. It's probably gonna be available in about a month or so. It's actually in a little bit better shape than the one that we missed out on. It's $500 more. The one that we would like to request to purchase is $3,500. It's a 16,500 pound trailer. It's got tandem axles on it, so it's got 4 tires. It would be absolutely perfect for the hauling of our skid steer. We would like to keep our existing skid steer trailer for hauling of other smaller equipment, but we do have a small, they call it a pan trailer, so we would get rid of one trailer with the acquisition of this. We took a look at the internal service fund, and our existing skid steer trailer has dollars in it that we would only need about a little bit less than half of what's in that fund. I talked to Lori and I told her that the new cost of this exact trailer is about $10,000, so it is a pretty good buy, and we've had pretty good luck getting equipment this past year from MnDOT.
Okay.
Move approval.
Got a motion by Kevin,
Second.
second by Jim, to purchase the skid steer trailer for $3,500. Any further discussion? All in favor?
Right.
Aye. Opposed? Okay, motion passes. Okay, we've got a meeting after this?
Right.
Okay.
Thank you.
Okay, Ben, your budget proposals for 2021?
Good morning, good to see you all.
Good.
We have a pretty easy budget for you. We're essentially staying flat. So I'll just kind of note some of the, some highlights of it nonetheless. One of the first lines you see, 6105, salaries regular. That's for our 3 educators in the office, Randy Nelson with agriculture and horticulture, and then the 2 4-H educators, Mindy Grant and Lisa Kassenbauer. And also included in that is $6,000 for one of our summer interns. That amount was supposed to increase by 2%, according to the contract we have with the county. But just given all the things going on right now and you know, unknowns possibly for counties across the state, we're not doing that increase for next year. So that's staying at 0.
I think I might interject there. As chair of the state AMC committee, Dean Durgan and I had a conversation early on when we were seeing the effects of COVID, and it was her recommendation to offer that there would be no new increase based on the hardship that counties are currently seeing. So I appreciate that from Extension.
Thank you. Above that, our one revenue item to note is that $10,000. That's the grant funding that comes from the Donald W. Grant family we've had in place for the past 5 years. We went back to that family to request that continue, and they've agreed to do that for the next 5 years. So it's actually a total of $15,000 we get from them for everything, but $10,000 goes towards Lisa Kassenbauer's position, and then the remaining $5,000 is used is put towards our interns as well.
So you mentioned the $6,000 that goes towards interns. I thought that grant covered all of it, but it only covers 5,000 of one. Is that what you're saying?
There's 2 interns that we have. So the $6,000 in that first line there, that goes towards one intern.
Okay.
And then the rest of the funding we get from grant funding and the Federation covers the other one.
Got a question on salaries. That you said there was no increase in salaries. Aren't they covered by the contract that we've got? Did they get a 2% increase, or aren't your employees covered by that?
The university employees, the educators, are not covered by that.
Okay.
So we do under clerical salaries. The one employee we have that is a county employee is Heather Weber, the office manager, and so that is a slight increase there. And really, all the only increases that we have in our budget is just a $15 increase for her salary, and then a few increases for her benefits as well, just underneath that.
Okay. Thank you.
And then we just had one small decrease a little further down, line 6820, our miscellaneous account. We just dropped that by $50 based on previous spending. So again, I think that ends up being around just a $160 increase, so essentially flat for next year.
Very good. Thank you. Any questions for Ben?
I know this isn't a department update, but in terms of how the extension went remote a lot sooner than a lot of other folks, in terms of how extension does business or gets the work that they're doing out to the communities, I mean, how have you changed service delivery?
Yeah, it actually went really well for us. I mean, we do use technology quite a bit, do a lot online already prior to all this. So it was really easy for us to pivot and just get, you know, for 4-H, for example, we did a lot of webinars and presentations for youth. We put together kits that were sent out to 4-H clubs and families for activities and learning that they can do. Unfortunately, with the county fair being canceled, we had to quickly figure out what to do with that, so we did online judging showcases for youth to continue to give them that opportunity. So that went well. So we did that for general 4-H projects, the county dog show, and then the livestock shows as well. Our horse show we did still have in person, just given the nature of that sort of event. So our staff have adapted really well, I think. Now that, you know, we've been in the summer now, they've been coming into the office more just to get materials ready and do things from the office. Randy Nelson has been, you know, still doing all his site visits and answering all his horticultural questions that come in from across the county. He also has some events later this year in December that he's planning right now, with the assumption that we can do those in person in some fashion. So we're kind of slowly making that transition back to.
So everyone is back in the office though, in a rotation, you said?
Essentially, they're kind of just coming in as necessary, but it's ending up being probably at least a couple days a week for each employee.
Okay, any further questions for Ben? Okay, no, thank you so much for
Thank you. Good to see you.
keeping your budget in order there. Thank you.
Thanks.
With that, we'll go on to Kevin Katzenberg, our Soil and Water Conservation District Director. Giving us some words of knowledge here.
Good morning, everybody. I appreciate being asked to come and present our 2021 budget proposal. I did have Steve pass out a sheet, kind of a summarized of summarization of where we're at in 2020 and kind of where we're hoping to be going in 2021. I asked him if that was something. Typically, I haven't passed out anything. He thought that if I wanted to do chocolate would be good, but I didn't want to have any preferential treatment, so I just made a sheet for you guys. Anyway, you know, our office was formed back in 1945, so we're actually observing our 75th anniversary. It came about because of the Dust Bowl era back in the 1930s. Not a whole lot has changed as far as our mission statement. Basically is kind of working with Clay County landowners is primarily where we're after. Definitely the coronavirus has put a little bit of a different twist of how we are doing business right now, but we're still programs and offerings that we're doing with landowners that have remained very consistent. I did a little update on you know, the number of customers that we dealt with, worked on with landowners last year. We did over 400, and at this stage of the game, we're at 366 already for this year. So we, you know, anything from tree plantings to no-till drill, customers that we have rented out to landowners. We have got, you know, you transferred the county ag inspector program to us. So those are things that we are working on daily, and you know, working from home remotely, we are doing the best we can. Some of our job duties require us to get out in the field, which is something that we take seriously and are continuing to do. So our 2021 budget proposal reflects a 2.1% increase over last year's budget, roughly about a little over $5,000. Primarily is existing salaries for staff and for our benefits. We did talk to Darren Brook earlier, and our board has typically followed the county's cost of living adjustments, so we're looking at 3% cost of living adjustment for staff and a 9% projected health insurance increase, which I don't like to see, but that's kind of where we're at.
You have all that summed up in 6905?
Total expenditure.
Correct. Kevin, I
Oh, I don't have a 6905, so.
Oh.
Yeah,
I'm sorry.
total expenditures is.
Oh, okay, okay.
Is $355,674.
Okay. So, you know, how we're funded, we are state funded with some of the programs that the Board of Water and Soil Resources has, and then some of the transfers of the state funds to the county that you guys have transferred to us. We also are county funds that the county feedlot officer position, county ag inspector, and a local water management levy, and then also the self-generated funds that we've got for our tree program, no-till drill rental program. And then just recently, we purchased a rototiller and a mower that we are hoping to get some business renting out for tree plantings. And we are also doing the Crestwood site out there. We're mowing that for the county. I guess going to our budget there, I have kind of a line by line. Kevin, you asked last year if I could put together something with the year-end results from 2019. So it is a little bit maybe more cumbersome, my spreadsheet that I've got there, but primarily our benefits and salaries is our biggest increase that we're looking at for this upcoming year. You'll notice in the district capacity grant, if you remember a few years ago, the state had a project or a fund of $100,000 coming to each SWCD, and then if the counties were willing to play ball with us and you guys were willing to at a tune of $18,000, the state would also come back and match that $18,000. So that went on for about 3 years. Last year that was not an option. The state just came out and had a flat $132,000, so they did not ask each county to participate in that. We haven't heard yet. August 26th of this year, we're looking at finding out from the state if that's going to be a reality again. We're hoping it's going to be the same, but there are some concerns with the coronavirus and how the state legislators are going to be acting on this. So all of our grants are, some of our 2-year biennium grants, we are pretty much assured of getting those, but it's the ones that we're concerned with is that district capacity one, and that's, like I say, it's a big chunk in our budget. It would be looking at this past year, $132,000. So we're hoping that the state Bowser can pull their weight and get those funds to be continued to our office, yet to be seen.
If you wouldn't get those funds, what happens then? You have to
Excuse me?
increase your, if you wouldn't get those funds, do you cut back on something, or do
Well,
you?
no, Gabe's position was basically created, our office, we were able to expand into our existing office space with that, so definitely something would have to probably change. I mean, we could maybe get by for a short time, but we've got our fingers crossed that the state will view this as a necessary fund to keep districts, because every district in the state got a certain portion of those type of funds. And our biggest concern is if they're gonna take away from those, where else are they gonna take away from? Like I say, a number of our grants that we get, our local water management, our Wetland Conservation Act, the feedlot funds come from MPCA. Those are things that we have great concerns with. We're hoping those things do continue as such. The Clean Water Fund is another source of dollars that the state has created to basically do projects such as we have a Buffalo River restoration project that we applied for last year. It got funded and it had $165,000 to do approximately 30 different erosion sites along the Buffalo River. We're in the process of doing that. That pot of money, they're looking at potentially taking some of those and making the shortfall rather than taking from our existing grants that we are presently getting. So.
Can you remind me again what the Metro Council bump was from? You don't have that sheet, do you?
I don't have a Metro Council bump, no.
It's, it went from the 2018 number 13,979 to 2019 actual was 20,022.
Well, Commissioners,
That's a
Kevin-
different,
Oh, that didn't make sense to me. Okay,
Kevin
it's a
took the
separate,
highlighted
okay,
criteria.
gotcha. I'm like, I'm on MetroCog, this doesn't make sense to me.
Neither,
Perfect.
Jenny.
Sorry.
No, that's okay.
Gosh.
I'm glad you figured it
No,
out.
it just, I gotcha, sorry.
No, that's fine.
Any
Like I say,
questions
our
relevant to
Our
the?
budget stayed fairly consistent as far
Yeah,
as programs and
right.
staff, that type of thing.
Sorry.
No, that's okay. Like, and there are different grants that we are applying for. We have, Minnesota Department of Agriculture has some county ag inspector grants to do some focusing on certain weeds. We've got one right now that the poison hemlock was found in Clay County last year. We're focusing on that. And one of our other grants, we're partnering with Becker County to do some, more on some of this wild parsnip project. We did a project with the University of Minnesota this past spring, a tillage transect survey. So a number of these grants come along throughout the year that unforeseen to us, when we submit our budget to you early on in the year, and they come along as the season goes along, we apply for, and they're competitive, and hopefully we get lucky and get some of those in place. The buffer grant is another one. We don't know for sure what's coming, and we're hoping that the projects are in place now. Most, well, Gabe, I know, was here last week, and we gave a presentation on, we're getting close to getting 100%. There's a few stragglers out there. But our hopes are to get everybody in compliance, and those are things that will continue, but the state legislators, they hold those purse strings, and we're kind of at the whims of what the legislators want to do. So our hopes that those things continue, because our role in this doesn't change. We're still going to be monitoring, as far as we know, for forever, that they want us to do a third of the county each year. So in 3 years, we'll have covered the county and start over again. So.
Just to go on to a different subject, weed inspector. Now, each township's supposed to have their own weed inspector, and I know at our township meetings, you always have a training session.
We do, yeah.
But they don't all come there, though, do they?
That is a problem, yeah. I know each township officer is by law a weed inspector unless the township designates a a certain person to be, so some townships have got a go-to person, some of them just kind of, every one of them is a township weed inspector. The mayors of each town are also are weed inspectors, and typically, we get a few complaints, we get a few complaints, we always get a few complaints, but we get a number of complaints from individuals out there that want to complain on their neighbors. On private property, that's not our role. Our role is working with the county property. So the properties you folks own, the roads, county roads, county ditches, those are things that we will be taking care of. But like I say, there's a number of individuals, his neighbor across the street's got weeds blowing. So we typically will get the township official involved, because they are more apt to know who those individuals are in their own township. But by law, like I say, they're supposed to have somebody to take care of those things. We're not opposed to going out there as a little, backup to, I'm not so sure every one of the town board officers know all the noxious weeds that are in question. So sometimes we get calls on weeds blowing or seeds blowing around, and they're not noxious weeds. So, not just because it's a weed in the wrong place, is it not necessarily be on the noxious weed list that Minnesota has. So there are certain ones that need to be controlled, and those are the ones that we're trying to work with. But we didn't get an opportunity to meet with our town board officials this past spring with the township officers meeting canceled. So hopefully something will loosen up this fall. I don't know sure what November's going to look like, but typically we have a workshop for town board members. And we've had a few sessions out in the country where we invite town board officials to come and visit, and we show them certain weeds just to get them more experienced and knowledgeable.
Okay.
I know your office sent out that media to landowners on a poster of weeds, and I think that's really helpful.
In some counties, I know have taken advantage of maybe some mailings going out with maybe the auditor, and maybe that's something we could work with Lori, so we could partner with them to pay for part of the postage, or include something in some of the things, because then you'd include probably most everybody in the whole county.
Yep.
And those are things like, that coverage is important. I mean, there's weeds in the cities just as well as out in the country, but typically the mayors are the small towns that we go to, but in Moorhead there is a weed inspector that we talk to, so. Anyway.
Well, thank you for giving us the information. If there's any questions for him, if not, thanks for the update, and thank you for keeping us current on what's happening out there.
You're very welcome, and always good to see you folks. Thanks.
Yeah.
Thanks, Kevin.
Okay, with that, we'll go into the Clay County Historical and Cultural Society. Maureen Johansson.
Thank you for having me. I think you have my 2021 request in front of you. It is for $202,559, which represents a 1% increase request. I don't have a full budget because our fiscal year is the calendar year, and we are just finishing our 2019 audit right now, and then that will be the basis for our 2020 budget. And of course, with COVID, we are looking at making some adjustments. So, we serve Clay County in a number of ways. Of course, our mission is to preserve, collect, preserve, interpret and share the culture and history of Clay County. We have about 12,000 artifacts that we store and preserve, and about 490 linear feet of archival materials at the MCOM Center. Currently, we have a large exhibit on World War I, the 1918 flu epidemic, and the anti-German sentiment during the war years that contain a lot of Clay County artifacts and stories. And that will be up through February, when a brand new exhibition will be up commemorating the 150th anniversary of Clay County. We're putting it up a year ahead of time in order to begin programming for the 150th in 2022. We also supplement some of our traveling exhibits with local content, such as the current smaller exhibition, Boys in Blue, on the Grand Army of the Republic, which was the fraternal organization of Civil War veterans. People may not think of Clay County when they think of the Civil War, but Clay County made its contribution, and we have a number of rare Civil War artifacts on exhibit right now down on the 3rd floor. We also provide exhibition space to regional art groups, including the Red River Watercolor Society, of which Clay County residents are members. And their National Juried Water Media exhibition is currently on display down in the 4th floor gallery. Our exhibits draw about 32,000 people a year in a good year, and we serve about 3,500 school children in a normal year. This May, we did not have our school children, and we missed them terribly. So, use of funds are used to support the collection staff salaries. Archivist Mark Peel, whose work is widely known and appreciated in the community, and who is often quoted in the papers when a historical perspective is needed. On any issue, basically. Collections manager Lisa Vida, who has care of the 12,000 artifacts, and our collections assistant Jenna Collins. Together, Lisa and Jenna recently completed a wall-to-wall inventory of all 12,000 objects, and they're in the process of photographing every object as well, with the notion of making those objects available online for people to research and for donors to be able to see their own objects. And to show their family members those objects. So, we have weathered COVID, the COVID crisis pretty well. We were shut down by the governor's order March 17th through June 15th. Our full-time staff stayed employed and worked from home for the 3 months, carrying out the planning work and maintaining memberships and donations, the newsletters, research and writing, grant writing, exhibition research, many educational webinars, and networking nationwide with the museums industry, with the museum industry, to stay abreast of what was going on nationally with the epidemic, and that kind of helped us make our decisions for reopening. We did prepare, as per the governor's order, preparedness plan, and including requiring masks and social distancing and room capacities, as well as frequent sanitization throughout the building. So far, no visitor has given us any problem with that, and everybody has stayed healthy. We hope to carry on as we have been until the vaccine is created. We know the future really depends heavily on the future of the U.S. economy going forward, and we're grateful for the county's support. We've been fortunate enough with the county's monthly support to be able to make payroll and to pay our bills, but we also have continued memberships and donation income, matching grant from the Fargo-Moorhead Convention and Visitors Bureau for $50,000, and support from the Margaret A. Cargill Philanthropies to help us get through these difficult times. We lost 3 months of admissions and gift shop revenue, and we're taking quite a hit. We're running at about 40% during our peak season right now, and so that's definitely going to impact our next year going forward. So we greatly appreciate the support we get from the county.
Okay, any questions from Maureen?
And not a question, but a comment. We don't set our preliminary levy and then our final levy to December. And I guess I would just like to, if you would follow up with Steve when you do have you mentioned there's going to be some changes to your 2021 budget because of COVID.
Well, I definitely think we'll be probably keeping as much of the same budget as possible.
Okay.
I'm doing a budget with no raises right now, as well as one with raises. And it'll be up to the board to make the decisions on that.
If you could just follow up when you do have
A budget.
just, you don't have to come back with it, but if you can just send it to Steve
bet.
and he can give it to us.
You bet, we'll do it.
Okay. Just continuing on with the historical side, not so much budget, but Steve, do we have, I know you got the 150th, not you, we have the 150th year coming. Did we ever appoint anybody to, do we take the oldest person in the county here? Wait a minute, no, not the oldest.
Well, then I make a motion.
Got to feel like getting involved in that. Do we have anybody that's knowledgeable in Clay County history?
No, usually
Mark is our person that we go to.
Yeah, that's what I was saying, Mark.
A number of the towns are planning their own community celebrations in 2022.
Okay.
And we've been working with them a little bit on their histories. And we have our exhibit, and we'll be planning some programs with the exhibit, but we haven't done any kind of county-wide. Perhaps the Clay County Fair Board would be a good, good opportunity to plan a celebration.
Okay. The next thing I had was just, are we okay on directors, or do we need any, did we have some resignations, or didn't we, or do we have enough directors on the board? Are we looking for more directors?
Oh, we have one opening that we need a board member for.
Okay, so if anybody's out there in the county that's interested in serving on the Historical Society
Please
board, we'd be
contact
glad to have you on board.
Indeed, we'd be happy to.
Okay, any questions on the budget for her? Not? Thank you, Maureen, for your presentation.
Thank you.
Okay, I think we're gonna take the committee reports first. Kevin, you wanna start us off today?
Oh, let's see. The only thing that I had last week was CARES Act Committee on the 29th. And we've addressed all of those issues. That's
Very good. Okay, Jim?
We had a death in the family, and I was involved with that all week, so.
Very good. Jenny?
I have 2 weeks worth of meetings to report on. The Planning Commission meeting met remotely. We had 3 applications up for review, 1 request for an amendment to a conditional use, and then 2 requests for interim use. They all passed. And then I've had several coronavirus relief funding meetings with city leadership, but with also our county committee. I think we addressed all of those in Kevin's report last week. Last week I also had the Cass Clay Food Partners steering committee and overall commission meeting. We discussed the ordinance in Fargo that they passed, the Boulevard Gardens, just reviewing it as they're halfway through that trial period. Monday I had Lakeland Mental Health. Good reports on all the different accesses. There continues to be good accessibility, and their new and reopened cases are continuing to rise with mental health needs. We talked a lot about the Moorhead schools and day treatment and how the schools are changing because of distance learning, how that affects their service delivery. We will be doing the executive director annual review soon, and their financials have been strong during this time, but that's really because they did some cuts to areas. So while it looks good, we'll have to address some significant areas as we move forward. And that concludes that one. And then last week, I also attended the CARES Act meeting with county leadership on the 29th. We talked about the recommendations that are coming to this board. That afternoon, I attended the MACA webinar with our administrator and our auditor. That meeting was with all the different counties, administration and auditor's office, and management and budget on reporting and allowable expenditures, etc. Then on the 3rd, which was yesterday, I had the other CARES Act committee where we can continue to talk about the community resiliency block in terms of how we'll address those costs there. I think that concludes my report.
Mr. Chair, I want to include 2 of the CARES Act committee meeting that was yesterday too. I didn't report on that.
Okay. My committee meeting was the PIC committee, which we had after last week's commission meeting. Kathy McKay gave us an update on COVID-19. We again went through the work policy that Darren Brooke presented, which we approved today. And then we went on to the ongoing maintenance for market study. Company, was it Drown or?
David Drown.
David Drown, okay. They came back with another proposal that we didn't accept the first one. They came back with another one with a lower price, and I don't think we accepted that one either. So at this time, we're not planning on doing a market study right now. So and that was the extent of that meeting. The one thing I had was before. We got a report on census here. Is that supposed to be covered today?
I was just going to touch base on it in my report.
Okay, very good.
I did have one other meeting I neglected to report on,
Go
sorry.
ahead.
I attended a webinar, Creating Resilience Communities. It was a recommendation by Rory Beal from Public Health. It was about what we need to know about childhood trauma by that Heather Simonich. I believe she was at one of our intergovernmental retreats at one point. Definitely a great topic, especially with the trauma that children may be experiencing with the COVID situation, so I attended that.
Okay, Steve.
Thank you, Mr. Chair. On the 28th, I attended the PIC meeting that's been covered. That afternoon, we had budget meeting with Extension and Ben that we heard this morning. On the 29th, participated in the Corona Relief Committee with county leadership that's been addressed. And that afternoon attended the webinar that Commissioner Mojo spoke on. The 29th, we had a series of calls with the city manager, Dan Molly, and Derek Lapointe from Moorhead Downtown Inc. And 29th, we also had county management. We talked about return to work policy that was addressed here this morning. We had an update from Kathy. We had a discussion on masks and responsibilities there and the budget process. On the 31st, we had participated in a city-county administrators meeting. Much of what we shared about was COVID-related in our counties and communities here in the region. On the 3rd, we have met with yesterday again with our coronavirus committee. Again, this week was our first week that, again, really due to the complexity of what we talked about this morning, we're beginning the committee is going to begin to meet 2 times per week. And so this was our first week that we did that. I had pre-budget meetings yesterday afternoon with juvenile facility and maintenance and family service center. And yesterday afternoon, we toured the DMV with Joe and Lori and kind of identifying possible solutions that we touched on as far as our presentation. Just had a couple other things. The open manager 3-year position, 3-year term, is in the paper again. We've posted it in all papers. We'll be accepting letters of interest until August 13th, with interviews planned for the board on August 17th. And so we had some questions at the board. I did reach out to Bowser in relation to statute. We're required to fill the position by 1 month prior to the end of a term. Being that we followed the statute the way and we just didn't find a candidate that this board felt successful with, Bowser felt that we were in compliance with the state statute and that re-advertising was the avenue that we should look at. Commissioner, Mr. Chair, addressed the census information that you have. You all have a document here. Vicki Clayton, our West Central Minnesota partnership through the U.S. Census out of Chicago, provides us a monthly update on the census, and just wanted to provide some information there. Clay County's response rate is up to 72.7%. That's about a percentage increase from a month ago. State average is 72.1%, so we're a little bit above the average, and the national average is 62.8%. If you do take a look, there are some highlighted counties and townships that fall below 1. The green are in the state average, and also the national average in red. And so I'll make an effort to get this information out to our cities and townships so they can work with their citizens to ensure they understand the importance of getting that information in the census. Again, it's a very quick process. Because of the COVID-19, the self-response time has been extended into October, the 31st, and so, but it's important for our citizens to understand if you've not responded in any fashion, starting on August 11th, you're going to have people from the census that are going to start knocking on your door, looking for that information. And so, again, they'll be wearing masks and taking safety precautions, but understand that starting on August 11th, if you have not responded, they will begin that process. Again, there's 3 different options to apply through the online census piece. Is a mail. If you received that questionnaire back in March, if you've lost that, you can still do it online by going to 2020census.gov. And if you don't have internet access, that you can have the ability to call 844-330-2020. And again, there's 13 different languages, both online and on the phone. I did want to touch base. Clay County is a part of the Moorhead Clay County Joint Powers Authority, or the MCC-JPA. We're working with the citizens as part of ensuring fair treatment as part of the diversion project. Over the last number of months, in almost years, that we've had land agents and AE2S working with citizens both in the north of Moorhead and the south side of our county in trying to get rights of entry to do testing. And we've had some challenges for a variety of reasons of getting some access to some of those properties. This board has had conversations with AE2S and through our committees, taking legal action was not something this board took lightly. In fact, you asked AE2S and the land managers to go out and have additional attempts, documented attempts to divert from the legal action. Yesterday I received 2 documents, 2 signed petitions from Chris McShane from Onsted Twitchell, who's a MCC-JPA legal counsel. Judge Rosenfeld's granted rights of entry on the 2 petitions listed. One of those petitions was for geomorphic and boundary surveys. It had 2 owners and 2 parcels were addressed. And we also had 1 petition that had examining surveying, mapping, conducting geotechnical studies, soil borings, geomorphic surveys, topographical surveys, and that included 16 owners and 11 parcels. And the rights of entries are currently ordered through December 31st of 2021. There were some stipulations that they're required to follow when attending or coming on the property, and so that's was also part of the order. 2, just wanted to touch base today at 10:30. Gabe Tweeten was part of a news conference where they announced a new emergency mass notification. Over the last 15 years, people have probably gotten used to the word code red. That gave us an updates on a variety of different issues, weather-related, severe weather, floods, fires, emergencies, road closures, utility issues that we could be contacted by this application. That will be ending at the end of this month, and starting at that point, we'll be working with the Everbridge company to establish that new alert, and that's going to be called the CassClayAlert.gov. So we need to make sure that our citizens, if they would prefer to continue to receive those types of announcements, they're going to have to go online to register before September 1st, so there's no delay. We also have the ability, if you do not have internet connection, that you can call FirstLink for assistance by dialing 211 or 701-235-7335. So just wanted to make that available to everyone, and that concludes my report.
Okay. That pretty much covers all the items that we've got on our agenda. We'll now go into a closed session for annual evaluation of county administration.
Move to close.
I'll second.
Here we got a motion by Kevin, second by Jenny, to go into closed session. All in favor?
Aye.
Aye. Opposed? Okay.
I made a motion to reopen.
And I think I second that one.
Okay, we got a motion by Jenny, second by Kevin, to reopen the meeting. All in favor?
Aye.
Okay. Anything further?
Mr. Chair, I think we were in closed session and we had a discussion with our administrator and annual review, and I think it's worth our commenting that that during this process, we've felt that he's been doing an exceptional job in his duties. And with that, because it takes board action, I would move that we authorize his step adjustment be approved for this year.
Okay, we got a motion by Kevin to approve the step adjustment for county administrator.
Second.
Second by Jim. Any discussion? All in favor?
Aye.
Aye, opposed. Okay. Anything further? We're adjourned.